My name is Padma Swami, and I'm part of the Pediatric Global Health Residency Program.
My name is Krish Subramanian. I'm a resident in Pediatrics and Global Child Health at Texas Children's and Baylor College of Medicine.
My name is Nate Sarazin, and I'm a resident in Pediatrics and Global Child Health at Texas Children's Hospital and Baylor College of Medicine.
My global health experience, I went to Swaziland. It's a little country that is in southern Africa. Swaziland has one of the world's highest rates of both HIV and TB. At first it was difficult to see the sheer amount of poverty and people coming in who were starving.
I actually served at the Center for Excellence in Botswana, and there got to witness sort of the incredible transformation, the real miracle that has occurred in HIV care for children in the last 10 years.
So I spent an entire year total working in Lilongwe, Malawi at one of the Baylor pediatric HIV sites. You step off that plane and it's almost impossible to explain exactly what's going through your head. It's a first time practicing medicine in this particular environment, and it's something that it's really challenging, and at first it's overwhelming. You have the opportunity to work with people who were the first ones to kind of answer that call. Their colleagues at the time were telling them these children are unsavable, and to be able to work with somebody who looked at adversity in the face and said these are children who are in need, and to have the determination to be able to persevere through that kind of environment is something that I will never forget.
There was this one child that I took care of who was 15 years old, and she was dying, and we got to spend Christmas with her, and that day she was just laughing and happy. While we can't provide everything in the world to a parent, if you're able to provide their dignity, I think it's the biggest thing that we can give.
There was a young girl, 17 years old, who is HIV positive, and she came to our clinic after quote-unquote defaulting on her medicine. The first thing I said to her is, "We're so happy you're here, thanks for coming." And she started to cry. She was so scared about how, whether the healthcare system would be angry at her. I just walked up to her and I gave her a hug and said, "No, you made such an incredible decision to come here and be here today." For me, it was just an example of, we never give up on patients.
What touched me the most about the patients was that even though they came with poverty, even though they had all these situations, these horrible social situations, the one thing that the people had was they smiled. They had a positive attitude.
And the other thing that you see as universal is just the love that parents have for their children. They will walk incredible distances to get their children into the healthcare that they need.
Coming back, I think the biggest thing that really grounded me was seeing my patients again. My time abroad made me a more patient doctor in some ways.
My patients that I see on a daily basis are coming into the same problems that I encountered, and it's all about that access to care. And so for me, being able to practice in Malawi or being able to practice in Texas Children's really isn't as stark of a contrast as it might appear on the surface.
What attracted me to Texas Children's and to Baylor was the vision to take incredible care that's done here in Houston and bring it to places that may not have access to that kind of care. Once you begin to recognize the impact that you could potentially have, I think it is almost impossible to walk away from both that obligation but also that incredible blessing and opportunity.
It is by far the most valuable year that I had for my residency training, and I think it has made me a much better clinician and physician, and for that opportunity I wouldn't trade the world.